Hello, Realtor Farm. Today, I want to talk about one of the most common questions I receive from expats and clients. How is healthcare in Palawan? Well, instead of giving you general answers, I want to share a real story, something I personally experienced just a few weeks ago. This is not a theory, this is reality. About 3 weeks ago, I found myself in a situation I never expected. I became the guardian of one of our renters, a foreign client who rented a house from one of our listed properties. He was living alone, with no family and no companion. Thankfully, the property is located inside a gated community, and the guard knows our team. One day, I received an urgent call. Emergency. So a neighbor found him unresponsive inside his home. Without hesitations, the guard called the emergency and coordinated and rushed him to a public hospital. So that's the first option. If nobody's gonna decide for you, they're gonna bring you to the public hospital, as public hospital is not expensive. So the first night, I stayed with him in the hospital. No sleep, no rest. Just making sure someone was there to assist him, or else they are not going to cater the patient without the guardian. By around 7:30 in the morning, but anyway, while I was there, there's a lot of people around it. I mean, in the emergency room of a public hospital, is the only foreigner up there. So I was even helping him cleaning the wounds, and cleaning him while waiting the nurses and everyone to help him. So, but by around 7:30 in the morning, I had to make a decision. I needed to find a caregiver to replace me because I could no longer function without rest. The patient is diabetic and on insulin. His blood sugar level was extremely high. In the emergency room, there were more than 20 patients, and the medical team was doing their best to attend to everyone. He was given multiple insulin shots just to stabilize his conditions. Eventually, he was admitted. He was moved to a ward, 3 days in a ward with about 10 other patients with related conditions. So in that 3 days time, there were a caregiver attended or became his guardian. So let's talk about the cost. The actual cost, the hospital bill was around 15,000 pesos. If you are a Filipino who is in a public hospital, this public hospital is gonna give you a zero bill, or depends on the cases, but more or less, for those especially very poor, so this is a zero bills. But since he is foreigner, and he, he cannot use or treated as same as Filipinos. So the nurses already informed me that there will be a bill, and it would not be a no bill. Okay. So aside from the actual hospital bill, the 15,000 more or less, so since we hired caregivers and other needs, you need to buy medicines outside or some basic needs, food and etc. for caregivers, it sums up into 12,000 pesos for caregivers and the rest. So total approximately 27,000. Affordable, yes, but you also have to understand the limitations in terms of space, attention, and comfort. So after 3 days, he was discharged, but his sugar level was still high. The patient was very confident that he could manage on his own when he gets home. But based on my experience as a part-time caregiver in the US before, I had doubts. I felt that he was not yet stable enough to be alone. And sadly, that concern became real. After just 2 days, the neighbor found him again, unconscious, unresponsive. Emergency vehicle again arrived to help him. This time, the situation was more serious. During the first hospitalization, anyway, many kind netizens helped me try to locate his family. I posted online to find his family. I don't have any choice. Then eventually, we were able to connect with his brother abroad. We kept him informed of everything, updates, conditions, and decisions. During the second emergency, I spoke directly to his brother and told him honestly he needs better care and aid. We all agreed to transfer or bring him to a private hospital. From there, everything moved quickly. He was admitted to the ICU to close monitoring. I rushed to the hospital again because I knew decisions had to be made and someone had to be physically present. So the guard told me again, and even those who rescued him, I don't want to bring him anywhere unless there is a guardian. So I was there. We meet each other in the hospital, in the private hospital. And again, I stayed overnight. Again, after 2 days in ICU, he was transferred to a recovery room. We arranged caregivers again to ensure continuous care. This time, the difference was very clear. Better facilities, more focused care, more organized system. Now let's talk about the actual cost for private care. For 2 nights in ICU, 2 nights in recovery room, CT scan, lab test, um, medications, or especially those, you need to buy some other uh, like insulin or some other drugs outside because not everything is available. So the hospital bill was 148,000. So convert it into a dollar. A dollar now is 60.10 or 60.15. $1 is 60 pesos and 15 cents. So the hospital bill was 148,000 pesos. Then additional expenses, medicines not available in hospitals, caregivers, food and other needs, around 35,000. To this private hospitalization, the total approximately 183,000 pesos. So, for those asking about healthcare, this is the real situation. Public hospitals are affordable but limited. Private hospitals provide better care but at a higher cost. Both serve their purpose, but preparation is important. Of course, I will recommend private hospital. So, important lessons here. From this experience, I want to share some important reminders, especially to expats or those planning to live here. Do not live alone without a support system. Always have emergency contacts. If you have medical conditions, monitor them seriously. Consider getting health insurance because your health insurance there in abroad might not be acceptable here. So ask ahead or research about health insurance if you are still allowed to have one. And most importantly, don't be overconfident about your health because emergencies can happen anytime. This experience was not easy, but I'm grateful that somehow in that moment I was able to help, even in a small way. This is more than real estate. This is about people, responsibility, and care. I remember my husband, a foreigner, of course, is telling me, why you do this? You cannot, that's us. We're really trying to help what we can. So that's the least we can do because there is no family in here. So I hope this will answer your questions about healthcare, and I am really sharing the actual experience and praying and hoping that he is going to recover soon and is not going to drink again to trigger his problem. So, and where in our case, it's not all the time we are available. We are also very busy to our day-to-day life. So if you have questions about living in Palawan, healthcare or real estate, dual citizenship, name it. This is Margie Vance Coy. I am a real estate broker here for 11 years. I live in the US for 7 years. And I'm a dual citizen, Filipino-American. So if you have questions, just comment below. And I hope that this sharing will give you any idea about here in Palawan, about retiring here in the Philippines. So this is your real tour, sharing real stories, real experiences to guide you in your journey here in Palawan. So welcome to those who are planning, and we're just here if you have some questions. Thank you. Have a great day.